When I give you pricing, I include price of surgery, the operation, the surgeon's fee. I include price of anesthesia, and I include price of operating room. In a lot of other locations, and of course every practice is a little different, you will see people giving you pricing separately for physician fee, and then the operating room where they're going to take you, whether it's hospital or freestanding surgery center, they'll give you their own pricing for operating room and anesthesia. In my practice, I give you one fee for everything, so there's not a surprise bill. Most common ones that I do is people after the weight loss procedure. We get a lot of people who lost 120, 50, 70 pounds, just depends. And so it depends on where you started, you'll have a different amount of extra skin. So my tummy tuck price will also vary how much extra skin and how much extra fat you have. So most basic form of a tummy tuck is just tummy tuck on somebody who's really lost all the fat. And so that tummy tuck starts around $8,000 or so. It depends again on your overall size, and if I have to do a little bit of liposuction to contour, the price will go up. If you have more tissue, if I have to do a little bit extra liposuction, actually do liposuction of the flanks, for example, to give you more of the shape, that will increase the price of the procedure because we're adding extra instruments, we're adding extra time to operating time, and they can go up as high as $11,000 based on how much skin I have to remove. In some people, we actually have to add extra procedure which goes towards the back, so like a back lift, because people lose so much weight, the gluteal area, the butt starts to slide down, and then we actually have to do the back lift, which is continuation of your tummy tuck. The scar goes all the way around, and of course price for that will add probably another $3,000. Tummy tucks start around $8,000. If we're talking about mini tummy tuck, now mini tummy tuck is below the belly button. We're just taking off that little extra flap on somebody who's already pretty skinny. That price will be a little less because it is not as involved where I have to put all the muscles back together. Another caveat, and that's why it's so important to see the surgeon for consultation, is to check to make sure you don't have any hernias. If you do have hernia, we might have to fix that, and of course that adds to the cost, and that's a whole nother level of conversation, which I prefer to do in person.